So firstly, I want to thank you all for joining us this afternoon. I have some information today about city operations related to the COVID-19 pandemic that I thought was best to tell you in person. So again, thank you all for being here. So we've taken the decision today to close 10 city facilities as of the end of today, following the direction of BC's medical health officer's direction yesterday to prohibit gatherings of 50 or more people. Our top priority remains the health and safety of our employees and public, and have and will continue to follow the advice of the medical health officer. Council staff and I are very aware this will affect many people in many ways. However, we all need to help reduce the spread of COVID-19 to lessen the impact on our healthcare system. We advised our staff and contractors about the need to close facilities in the best interest of public safety. We have done that over the course of last night and this morning. Based on the BC Medical Health Officer's direction yesterday, as many others have, we decided it was best to err on the side of caution and close 10 city facilities that provide programs or gathering spaces for members of the public. We are dealing with a rapidly changing situation that even the public health professionals will find challenging to keep up with. And you're probably all aware right now, even the provincial government is holding a press conference, which could potentially put even this new information out of date. So we're doing the best we can to keep up. This is new territory for everybody, and we continue to listen to the direction of the BC Medical Health Officer and take local action to balance the public's best interests. We are mindful of the impact on the livelihood of people who provide these programs and services, but our ultimate responsibility needs to be focused on what we must do to preserve public safety. That's why we are closing the following city facilities until further notice: Parkinson Recreation Centre, Kelowna Community Theatre, Black Box Theatre, Rutland Arena, Memorial Arena, Rutland Activity Centre, Parkinson Activity Centre, Okanagan Mission Activity Centre, the Kinsman Fieldhouse, and the Mission Media Centre. We will maintain essential services and other operations, and we will continue to monitor those services and be prepared to react if that's what's needed in the days, well actually hours, days and weeks ahead. For the most up-to-date confirmed information about what the city is doing to support public health, visit kelowna.ca. I urge everyone to take the medical health professionals' advice seriously and practice good hygiene, such as washing your hands often. As I said yesterday, these are anxious and difficult times, but Kelowna has seen many difficult times before, and I believe we can rise to the occasion and again show our best selves in the face of adversity. I want to thank the city staff for working diligently to manage operations and keep people safe and informed about what our actions are to curb the spread of the virus. So I have some staff with me today who can help answer some of your questions. I'm joined by the city manager, Doug Gilchrist. Stu Leatherdale is the Divisional Director of Human Resources and Community Safety. Jim Gabriel is the Divisional Director of Active Living and Culture. And Lance Kfish is our Risk Manager. So that concludes my statement. Happy to take your questions, but we'll likely have them answered by those who are part of our critical incident response team in regards to what your queries may be. So, that being said, are there any questions at this time?
I just want to know, do you think you're going far enough with this? Do we need to close other things down? Do you think that's enough?
Sure. Won't sound a lot.
Thanks for the question. Yeah, certainly we want to continue to monitor this and take quick and swift action on the advice of the medical health officer. There may be other services and programs that we look to limit, and we're meeting daily to talk about those things, make those decisions. Best interests of both our staff as well as the community members.
Has there been any discussion yet about establishing a state of emergency within the city like other cities have before?
It's something certainly we're evaluating. Any powers that come with the state of emergency that would be useful to us, we would take that action if and when necessary. The CAOs from the region are meeting tomorrow to talk about that topic, to see if it would be useful in some of our decisions. At this point, we're very comfortable with the authorities we have to make the decisions today.
What about businesses downtown? What are you guys talking about helping us?
Certainly,
Parking, vehicles, fees.
Yeah, certainly city staff are liaising with the Downtown Kelowna Association and trying to work with all the businesses. Our council and staff are very supportive of local business and doing our best to help where we can. That's not a decision that isn't a decision that's been made yet.
Public hearings, are they going ahead?
The public hearing tonight is going ahead, but we are taking precautions to ensure we can have social separation and meeting the requirements of the medical health officer. I think it would be unlikely that we'd go beyond 50 people based on the agenda that's there tonight. So I think we can meet the standards that are expected of us for tonight. We'll be reevaluating future public hearings.
What happens to the status of the employment of people affected by these closures?
I think I'll ask Stu Leatherdale to comment on that one. Thank you.
Yeah, hi. Obviously, we take decisions like this very seriously as it relates to our staff. Unfortunately, today we've had to lay off 65 permanent part-time staff that work in the active living and culture division. The remaining full-time staff we're working to redeploy to other city units at this point.
And there's, under these circumstances, there's no special considerations?
No, although I believe EI is waiving waiting periods, so we provided information to staff on that.
Is the city going to start urging larger private facilities to close?
Private facilities? Yeah, on private facilities, we certainly respect the decisions of our partners and nonprofits to do the right thing and follow the medical health officer recommendations as well. And I think that's what we've seen happen with most of them so far.
And what's the plan for regular city hall and for Monday meetings?
Yeah, so for the time being, Monday meetings will continue. We want to keep the business of the city moving so long as we can without putting people at risk. We are taking the precautions recommended around separating of staff, recommending that people use remote services where possible, enhanced cleaning of facilities and things of that nature.
Are you looking into perhaps rearranging the rules for how these meetings are held so that you could conduct, for instance, a public hearing without having people assembled in chamber?
We're certainly evaluating that. We do have remote capabilities for some types of council meetings, but public hearings are very difficult to meet. So we'll be revisiting that after tonight's meeting.
What precautions is the city taking when it comes to transit?
For transit, perhaps Lance, do you have any comments on transit?
Yeah, regarding transit, what I can tell you is that we have been in contact with BC Transit and our partners there, and they do have a pandemic plan where they're monitoring the situation closely, just as we are, and we're confident that they will be able to adapt to the changing circumstances. They hear more news from the medical health officer as well.
Have you heard anything that's happening now? Any added sanitation or anything that's ongoing now?
Absolutely. There are more regular cleanings of buses occurring, and people are being encouraged to follow social distancing procedures as well.
For people experiencing homelessness in the city, is there any initiatives for homelessness for social distancing among the population?
We understand that the medical health officer is providing advice to various agencies, including those agencies engaged in working with the homeless population, and that's BC Housing's responsibility to work with their partners on that.
Can you give us your name and your title, please, when people come up? Maybe you could just give us name and title, please.
Yeah. My name's Lance Kafish, and I'm the risk manager for the City of Kelowna, and I'm working closely with our critical incident response team for this event.
Thank you.
What assurances can you give people around water, garbage collection, those are kind of essential things?
Absolutely, that's a great question. The city's number one priority in a time of crisis is to ensure those essential services are maintained. So the most critical parts of our pandemic plan revolve around ensuring that safe drinking water will be available to the community at all times, toilets will flush, and those essential services will be maintained.
Garbage collection as well, I imagine that's continued.
Absolutely. Garbage collection is done, of course, through a third-party contractor, but the provisions of that contract allow for it to continue as long as they're able to manage any absenteeism that they might be experiencing. But in addition to that, we're working closely and looking at what sorts of things and procedures we would adopt at the landfill to streamline things to ensure garbage collection continues to occur. And that means we'd have to slow down or limit some other services in the meantime to get those priority services delivered. That's what we're prepared to do. I don't know that's something.
Thank you, Lance. Yeah, Doug Gilchrist, City Manager. At this point, we're continuing to work with our small business associations. We don't have any specific plans for enhanced service or support at this point, but we're willing to work with all our partners throughout the city as things change quite dynamically.
Public libraries, have they been closed?
They closed yesterday.
It is closed.
All right.
Good. Thanks very much, everybody.
Thank you, everybody.